Dr. Goy, we've known each other for more than a few years, and your commitment to medicine, your commitment to cancer research is unprecedented. This award that you're receiving, what does it mean to you in the context of your life's work?
Well, I'm very honored and very proud to receive the award. It is the best time to be in oncology, so it's a perfect time to receive an award to where we're going and what we have been.
Where are we going?
We are at an inflection point in the history of medicine. I'm convinced that medicine in the next 2-3 decades will change more than in the last 100 years. There will be a revolution that is already ongoing with novel therapies, immunotherapy, the ability to really finally dive into precision medicine, digital world that also brings health and healthcare management with consumerization of medicine. And this will help actually force us to reinvent the way we deliver health and healthcare because we can't afford the way it is now. We need to focus on improving the outcome to optimize decisions. So we have an opportunity using big data, using new technology to really deliver a much better product. I think this is really a very amazing time to be, and I always say that to the young doctors when I see them in the rounds, that you have to pick oncology. This is one of the most exciting platforms to develop precision medicine and precision therapeutics.
Go back a few years when you made the decision to focus in this area of cancer research. Why did you make that decision? Because you could have gone into so many other areas of medicine. Why this area?
I knew what I didn't want to do. I wanted a specialty.
You knew what you didn't want to do.
Exactly. I wanted a specialty that would be very dynamic. I wanted a specialty that would be facing acute care, but also close to the lab and the research. So oncology was one of those specialties that I became interested in, and then as you obviously know, that one of my first patients was actually my mother with ovarian cancer, so I had to really lead the battle on this because no one wanted to treat her because the situation was very advanced at the time, and she responded very well, and so this was one of the first examples that you need to push the envelope a patient at a time.
What impact did that have on you?
Well, treating your mother as your first patient is a tremendous impact because I had to be involved both as a doctor, advocate of the patient, but also the logistics and literally go and drive my mother back and forth to the chemotherapy sessions. It really gave me a very strong example and confidence that you need to think outside the box. You need to try to be forward and try to really push every patient's opportunity the most that you can. And it is a terrific time, as I mentioned before, because the tools that we have now are allowing us to actually bring patients back from hospice sometimes. We have patients that have, for example, melanoma with brain mets that actually now used to be sent to a hospice that now can be cured. We also have immunotherapy with the CAR T cells, which is gene-modified T cells, as you know, that have been approved now for the first time a live cell therapy in refractory lymphoblastic leukemia in August last year, and in November in aggressive lymphoma. We have been part of this for 7-8 years with the Rosenberg group at the NCI Adjunct Cancer Center. And that's perfect in tradition to our cell therapy approach, having one of the largest transplant programs in the nation. But what we see in those patients is that 85% of the patients who have failed every standard therapy, multiple lines of therapy, including high-dose therapy and transplant, respond to these novel therapies. So this is, one of the new chapters that is opening in oncology. So when you want to try to push the envelope, we now have the tools to do that.
The EJI Awards for Medical Excellence, one of the big parts of it is the awarding of scholarships for students to pursue their graduate medical education. What does that mean?
I think as part of our mission is not only, as I mentioned, to be involved hands-on in the research and push the envelope, the discovery, because of all the platform that we have. For example, there's 10,000 new drugs in the pipeline of medicine now, 2/3 are in oncology. So we have a lot of work in front of us. So we have this, but part of our mission is also to teach the next generation of doctors on how they're going to approach patients, on how they're going to be able to implement precision medicine, how they're going to be able to be engaged and responsible in making a cost-effective medicine with the best outcome. So this gives us a responsibility, actually, because we have the tools to do that, to really foster these guys and these students to go into the right field, and also to try to push them into embracing research and innovation from the get-go, not just to learn on to be a doctor, not just to learn on to be an innovator.
your passion for your work, not just the clinical side, not just the research side, the teaching, the mentoring, it's as strong as ever.
Yeah, and I mean, it should be, given all the tools that we have again. I actually am accepting this award also on behalf of all my colleagues for what we have done at John Terry Cancer Center. You know, we had our 25th anniversary 2 years ago, and I invited Siddhartha Mukherjee to run a panel with me on the future medicine. And this was amazing. You know, when you look where you have been as a group of oncologists in 27 years now, starting with 2 chairs at Hackensack, now with 150 chairs on site and an additional 200 chairs for fusion chemotherapy in the network. This is a testimony to our commitment to try to push the envelope, as I mentioned before, and to bring new options to patients. Having the ability to develop, to bring investigators and the profile of investigators that want to join us is also very exciting. Develop a phase 1 unit, first in humans, novel therapies, new option to patients, a platform of cell therapy, bone marrow transplant, all of this, plus our affiliation with Georgetown, gives us an opportunity to continue build up on the academic center with a medical school, the research center at Roche, ex-headquarters, our partnership with Memorial Sloan Kettering. All of this makes it a terrific, testimony of what we have, where we have been, but very, very exciting time where we're heading forward. And accepting this award on behalf of my colleagues, and I'm very thankful to their commitment as well, helping us to do all this. Altogether, I think we can change cancer.
Thank you, Doctor.
Thank you.